In this video by deckplate we will understand the VA rating for vitiligo, chronic urticaria, vasculitis, and erythema multiforme. Disclaimer: this video is for educational purpose only. It's not intended for doctor-patient or lawyer-client relationship. Veterans dealing with skin conditions such as vitiligo, chronic urticaria, vasculitis, and erythema multiforme may be eligible for VA disability benefits. These conditions can significantly impact one's quality of life. Here's a detailed look at the VA ratings for each of these conditions. Vitiligo, diagnostic code 7823. Vitiligo is characterized by the loss of skin pigmentation, resulting in white patches on the skin. Vitiligo is rated at 10% if it affects exposed areas, and at 0% if no exposed areas are affected. Diseases of keratinization, diagnostic code 7824. Diseases of keratinization include conditions like ichthyosis, Darier's disease, and palmoplantar keratoderma. These conditions are evaluated under the general rating formula for the skin. Chronic urticaria, diagnostic code 7825. Chronic urticaria is defined by continuous episodes of urticaria occurring at least twice per week for 6 weeks or more, even when off treatment. Chronic refractory urticaria that requires third-line treatment, such as plasmapheresis, immunotherapy, or immunosuppressives, is rated at 60%. 30% rating is assigned for chronic urticaria requiring second-line treatment, such as corticosteroids, sympathomimetics, leukotriene inhibitors, neutrophil inhibitors, thyroid hormone. Chronic urticaria that requires first-line treatment, antihistamines, is rated as 10%. Vasculitis, primary cutaneous, diagnostic code 7826. Vasculitis involves inflammation of blood vessels and can cause significant skin issues. The VA rating for primary cutaneous vasculitis depends on the frequency and severity of the episodes, as well as the treatment required. Persistent documented vasculitis episodes that are refractory to continuous immunosuppressive therapy are rated at 60%. For a rating of 30%, all of the following criteria must be met: recurrent documented vasculitic episodes occurring 4 or more times over the past 12-month period. Requiring intermittent systemic immunosuppressive therapy for control. A rating of 10% is assigned if at least one of the following criteria is met: recurrent documented vasculitic episodes occurring 1 to 3 times over the past 12-month period and requiring intermittent systemic immunosuppressive therapy for control. Or if there are no recurrent documented episodes but continuous systemic medication is required for control. Alternatively, vasculitis can be rated as disfigurement of the head, face, or neck, diagnostic code 7800, or scars, diagnostic code 7801, 7802, 7804, or 7805, depending on the predominant disability. Erythema multiforme and toxic epidermal necrolysis, diagnostic code 7827. Erythema multiforme and toxic epidermal necrolysis are severe skin conditions that can cause significant mucosal, palmar, or plantar involvement. Recurrent mucosal, palmar, or plantar involvement that impairs mastication, use of hands, or ambulation and occurs 4 or more times over the past 12-month period despite ongoing immunosuppressive therapy is rated at 60%. For a rating of 30%, all of the following criteria must be met: recurrent mucosal, palmar, or plantar involvement not impairing mastication, use of hands, or ambulation, occurring 4 or more times over the past 12-month period and requiring intermittent systemic therapy. A rating of 10% is assigned if at least one of the following criteria is met: 1 to 3 episodes of mucosal, palmar, or plantar involvement not impairing mastication, use of hands, or ambulation, occurring over the past 12-month period and requiring intermittent systemic therapy, or without recurrent episodes but requiring continuous systemic medication for control. These conditions can also be rated as disfigurement of the head, face, or neck, diagnostic code 7800, or scars, diagnostic code 7801, 7802, 7804, or 7805, depending on the predominant disability. Note that for this diagnostic code, systemic therapy may consist of immunosuppressives, antihistamines, or sympathomimetics. Thank you for watching this video. Please don't forget to subscribe and like our videos.